As you know, it's important to me that the supplements I recommend and use are of the highest quality. That's why I stock the Protocol for Life Balance product line at my online dispensary, drhoffman.com/Protocol for Life Balance. Protocol for Life Balance offers a wide range of professional-grade products using ingredients backed by strong scientific research, including a suite of supplements specifically designed to support neurological health and cognition: Coggumin SLCP, Magtine, phosphatidylserine, and Brain Regain. Coggumin SLPC is curcumin optimized to penetrate the blood-brain barrier, where it helps protect brain tissue. Magtine may support healthy cognitive function, learning, and memory. Phosphatidylserine supports neuronal membrane fluidity, promoting cognitive function and mental acuity. And Brain Regain is a broadly useful herbal health aid that may be advantageous for supporting healthy cognitive performance. For more information and to order, just go to drhoffman.com/Protocol for Life Balance. That's drhoffman.com/Protocol for Life Balance. Protocol for Life Balance is an A-rated GMP manufacturer of premium dietary supplements.
Welcome to Leyla Muedin. I'm your host, Leyla Muedin. I'm a registered dietitian here in New York City. If you would like to reach me for consultation, the number is 212-779-1744. That's 212-779-1744. Feel free to reach out. I want to talk to you today about liver disease, but I want to talk to you about liver disease, which is rampant in our country. And it's even been renamed to metabolic dysfunction associated steatotic liver disease, MASLD. It used to be NAFLD, meaning non-alcoholic fatty liver disease. It's metabolic function associated steatotic liver disease, which is exactly what it is. So the name is actually more true, in my opinion. Let's talk about alternative sweeteners. And this is coming to you from Integrative Practitioner. It's a very nice journal. Alternative sweeteners like sucralose, you've heard of Splenda, that's the yellow packet. Aspartame, that's Equal, that's the blue packet. And sugar alcohols like sorbitol, maltitol, even xylitol, erythritol. Alternative sweeteners like sucralose, aspartame, and sugar alcohols. These are usually viewed as healthier substitutions for refined sugar, right? However, new research has found that sorbitol, which is a sugar alcohol, may not be a healthier alternative. I want to remind everyone that sorbitol is, for the most part, the most common sugar alcohol found in a lot of low carbohydrate products, processed food products. Well, new research is finding that sorbitol may not be a healthier alternative. A study by Washington University at St. Louis found that sorbitol can be converted into fructose by gut bacteria, which can be harmful to the liver when consumed in large quantities. Fructose activates the liver's sugar processing mechanism, resulting in excess storage of sugars and fats. Think your soft drinks and fruit drinks and all of that. That's where we're getting excess fructose. And, of course, high fructose corn syrup in many of our processed foods, but especially beverages. So MASLD, which is metabolic dysfunction associated steatotic liver disease, is the most common cause of chronic liver disease and affects about 30% of the world's adult population. It's often associated, as you would think, with overweight or obesity and cardiometabolic conditions such as prediabetes, type 2 diabetes, high blood pressure, high lipids. We call that dyslipidemia, cholesterols, triglycerides. And certain gut microbes can protect the liver by depleting or modifying dietary substances before they're absorbed and delivered to the liver. However, when the right gut microbes, if they're not present, after sorbitol is carried to the liver, it can convert into fructose. And thus, this may damage the liver. I could think of another situation where gut microbes are responsible for a consequence. If you're eating a lot of high oxalate foods and you don't have enough of beneficial Oxalobacter formagenes in your gut to help metabolize the oxalate in food, it may predispose you to kidney stones, right? So in this case, without enough of the right gut microbes, if you're having sorbitol, which is a sugar alcohol, if you're consuming it, it can convert that to fructose and cause liver damage. They did a test using adult zebrafish to assess changes in the gut microbiome that could lead to liver disease. These zebrafish, they were split into two groups: those with a depleted gut microbiome and the control group that didn't have their gut microbiome altered. Now, it was hypothesized that those with depleted gut bacteria would accumulate diet-derived chemicals in the intestines, liver, and in blood, in serum. The treated fish were kept in a tank with sterilized facility water and antibiotics. The control group was kept in normal sterilized water. The fish were fed once daily, and they were treated for 7 days. At the end of the 7 days, their blood was collected, and using different methods of tracing and assessment, the research team was able to identify sorbitol as a key metabolite produced from dietary glucose within the gastrointestinal tract in the zebrafish without bacteria. Now, even though sorbitol is conventionally believed to be poorly absorbed in the intestines, the results of this study showed that sorbitol accumulated in the fish with microbiome depletion and was transferred to the liver, where it rewired liver metabolism and caused fat storage, aka lipid biosynthesis. The researchers also sought to determine if high levels of the sorbitol mimicked the glucose-derived sorbitol in the intestine. Sorbitol was dissolved in the tank water, and fish from both the control group with the depleted microbiomes were transferred to the tank containing the sorbitol supplementation. And through their methods of tracing, it was found that the presence of gut microbes decreased a fraction of the exogenous sorbitol that reached the liver, but not enough to prevent the sorbitol from being converted into fructose in the liver. The fish that had their microbes depleted had 15 times more sorbitol-derived fructose in their livers. This indicates that sorbitol from external sources, such as candy and gum, can still be detrimental to liver health if consumed in high amounts. Now, the research team also tested to see if antimicrobials affected sorbitol production. By examining the tissues, they discovered there was no difference in how much the liver absorbed sorbitol or how much it converted to fructose. Now, this suggests that antimicrobials do not influence sorbitol metabolism in the liver, regardless of gut microbiome or lack thereof. But to see if glucose-derived sorbitol could be prevented from developing in the gut, the team also conducted an experiment with a particular drug. It's a drug that blocks the enzyme responsible for converting glucose into sorbitol on the zebrafish. And they found that this drug, apalrostat is what it's called, reduced sorbitol levels by about 50% in the microbiome depleted fish, compared to those only treated with those antibiotics, those antimicrobials I told you about earlier. The fish treated with both antimicrobials and apalrostat even demonstrated no development of liver steatosis, liver fat accumulation, compared to fish without a microbiome that didn't receive the drug. Additionally, liver glycogen levels were significantly reduced by apalrostat treatment. You need to know that glycogen storage is phase 1 of fat storage. That's why this is significant. When you're trying to restore your glycogen after a hard workout or a long run, it's phase 1 of fat storage. And by using the apalrostat treatment, liver glycogen levels were actually significantly reduced. So this demonstrates that reducing sorbitol production in the intestine is sufficient enough to prevent liver fat accumulation in zebrafish lacking a gut microbiome, and highlights that sorbitol synthesis in the intestine is a key driver behind fatty liver, behind liver steatosis. So now, of course, more studies need to be conducted to fully understand the specific mechanisms for how bacteria degrade sorbitol. But nonetheless, the study supports the idea that sugar replacements may not be healthier. And while sorbitol may be lower in calories, have less influence on blood glucose levels, it could still lead to liver disease. And you need to know that if you do have obesity or diabetes and you're consuming a lot of sorbitol, sugar alcohol containing products, you are still at risk of developing fatty liver disease, which is metabolic dysfunction associated fatty liver disease. That's what that is. So it's important to know using these alternative sweeteners, even the sugar alcohols, which we really think are safe, may not be. And for most people, they're not. I have to tell you, just from my own clinical experience, that many people do run into a problem, whether they're over-consuming sugar alcohols, which can have a laxative effect, cause a lot of GI distress before that laxative effect occurs, like a lot of bloaty, crampy, gurgly, flatulence, all of that kind of thing, and then diarrhea, or very, very loose stools. That's what's occurring there with high sugar alcohol intake. And a high sugar alcohol intake, that could be as much as 2 protein bars, 2 low-carb protein bars. It's a problem. Generally, I've seen the upper tolerable limit on sugar alcohols to be about 20, 25 grams a day before this laxative effect. And again, there may be this impact now on liver. And it's important to be aware of that. 30% of the world's adult population have fatty liver disease. And it does not necessarily have anything to do with alcohol consumption. We're talking not about alcohol-induced fatty liver disease, the precursor really to liver damage, cirrhosis of the liver, all of that. We're talking about this metabolic dysfunction-associated fatty liver disease. And we're seeing this more and more in children. And we need to be aware of it because all of that sugary breakfast cereal, the soft drinks, the fruit drinks, even smoothies deemed as healthy but containing too much fruit or other sweeteners, you have to watch that. All of these contribute to fatty liver. Yes, sugar alcohols like sorbitol are not necessarily recognized by the body, by the intestines as carbohydrate. They don't necessarily maybe have an impact on blood sugar, although in other people it does. In many people it does not. And they figure it's your get out of jail free card to having that because, hey, my blood sugars are high, I'm pre-diabetic, I'm diabetic, but consuming these sugar alcohols don't impact my blood sugar according to my finger sticks or my continuous glucose monitor, you may be saying, right? But it could still be harming your liver. And that's something that needs to be watched. And if you're on prescription medications, maybe you're taking a statin for your cholesterol. Maybe you're taking other diabetes medications, right? All of these can affect the liver because the liver is responsible for detoxifying everything. But add to that the insult of these alternative sweeteners like sugar alcohols equal Splenda, respectively aspartame and sucralose. There's still a problem. We know that aspartame and Splenda do impact blood sugar levels, right? And can still harm the liver. But they're finding sugar alcohols like sorbitol. Again, a lot of people think they're okay with the sugar alcohols. And this is showing that this is not the case. So, metabolic dysfunction-associated liver disease is a problem, MASLD. MASLD stands for metabolic dysfunction-associated steatotic liver disease. And it is the most common cause of chronic liver disease. 30% of the world's population. That's a lot. Well, it goes to show, with all the overweight and obesity, cardiometabolic conditions, high blood pressure, prediabetes, type 2 diabetes, these are all on the spectrum. So these are the epidemics in our world. And these alternative sweeteners don't help. You also have to keep in mind, if you're using these alternative sweeteners and you're using ones that impact blood sugar and insulin, like Splenda, like aspartame, it can impede any weight loss effort. The fact that you're still stimulating insulin, which is a very important hormone, but it's also a fat storage hormone. This is also very important. At the end of the day, its job is to store fat. Insulin's job. It doesn't help in your efforts. You're following a low-carb diet, you're eating beautifully, you're doing all the right things, you're exercising, but you're using these alternative sweeteners, and they're really reducing those effects that you're trying to achieve in healthy lipid parameters and healthy metabolic parameters, all of that, and any weight loss efforts. This is very important. So please be aware of that and decide that you're going to kick the sugar habit once and for all and not keep yourself craving sugar all the time. We need to treat sugar, or that sweet craving, how it should be treated. A lot of people are truly addicted to sugar, and they've replaced it with these alternative sweeteners. It's time to stop the alternative sweeteners. I want to thank you for joining me on another edition of Leyla Muedin. This is Intelligent Medicine.
I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Leyla Muedin, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.